Have you ever had to go to the bathroom really bad, like it was just about to come out? Or what about having to know where the bathroom is every time you enter a building? These are two things that people with Crohn's and colitis have to deal with every single day of their life. I have multiple people in my life that have this terrible disease. When talking to my best friend that has Crohn's and colitis, he has a tremendous amount of stress on him. Waking up and being stressed. Going to school and being stressed. Going to sleep and being stressed. Being in school with this disease is not easy as well. Always having to go to the bathroom during class, missing notes, missing tests, and just missing school in general. He even missed months of school because he had to have surgery, and he had to be in the hospital all the time. Some other things that happen when you have Crohn's is weight loss, rectal bleeding, and diarrhea. Not many people know what Crohn's and colitis disease is, so I'm going to tell you a little bit more about it today, and hopefully you will learn that this is a terrible disease just like many other diseases in the world. So what is Crohn's and colitis? Crohn's disease and colitis are both major categories of inflammatory bowel disease, IBD. IBD affects an estimated amount of 1.6 million people across the United States. With this disease around the world, around $1.84 billion is spent to treat these patients. The mean annual direct cost is around $19,493 per patient. The chronic disease tends to run in families, and they can equally affect both men and women. Some symptoms of this would be diarrhea, rectal bleeding, urgent need to remove bowels, abdominal cramps, and pain and constipation. Some general symptoms of IBD are fever, weight loss, night sweats, and loss of appetite. As you can see with everything that I've been saying, all these problems are inside the body, and no one can actually tell who has Crohn's and colitis disease. This is a disability that people have that can't see and extremely difficult to live with. So many of you may ask, what causes IBD? No one is entirely sure or understands. It is known that IBD involves an interaction between genes, the immune system, and the environment around everyone. The immune system usually attacks and kills foreign invaders, such as bacteria and viruses. But people with Crohn's and colitis, the bacteria are mistaken for harmful invaders, and the immune system mounts a response. IBD patients are also at risk of getting other diseases such as cancer, blood clots, and PSC. Crohn's and Colitis Foundation Association, CCFA, is the largest voluntary nonprofit health organization dedicated to finding a cure for IBD. CCFA has also played a role in every major breakthrough since the founding in 1967. CCFA's mission is to cure Crohn's and colitis, and also to improve the quality of life in every children and adult that is affected by this terrible disease. When donating to CCFA, the money goes towards research, providing educational resources for patients, medical professionals to take care of the patients, and the furnishing supportive services for people with IBD because it is such a stressful and anxiety disease to deal with. The American Institute of Philanthropy gave Crohn's and Colitis Foundation one of only 6 A's ratings out of 44 charities in its most recent Watchdog report. The foundation also consistently meets the standards established by the Better Business Bureau Wise Giving Alliance. Most people develop these diseases between the ages of 15 and 35, but they can occur at any age. 1 in 10 IBD patients are under the age of 18. I'm going to conclude with the very first time I found out that my best friend was diagnosed with Crohn's and colitis. Me and my friend were driving to a party in high school, and he felt very nauseous. He felt like he was going to throw up. So as a regular 16-year-old would do, I pulled over on the side of the road, and he got out of the car and started throwing up, and I didn't know what to do. I yelled at him. I said, "Max, are you okay?" He goes, I'm fine. So we got back in the car, and as regular high school students would do, we started going to the party as well. Then around 2 to 3 minutes later, he said he had to go to the bathroom. So, as a normal friend would do, I stopped at a local restaurant, and he went to the bathroom. After about being inside for 10 minutes, and me waiting in the car for 10 minutes, he's still not come out. So I went inside, and went to the bathroom and said, "Max, are you okay?" He goes, I'm fine. I was like, okay. He said he's fine. Okay. So I went back inside the car to wait for him. After a couple minutes of waiting, he came back in the car, and I said, "Max, what is wrong?" He goes, "David, I'm fine, seriously." I go, "Max, I've known you since preschool. I know something's wrong with you." He goes, "Fine, I have Crohn's and colitis." I didn't know what to do. I didn't know what to say. We sat in the car for 45 minutes and just talked. We skipped the party, and all we did was talk about he was telling me what Crohn's and colitis was, how it's treated, and whatnot. And I just didn't know what to do, so we just sat there. Having to see what my friend goes through on a daily basis, no one should go through that alone. On a different route, my fraternity at U of I, we're having a philanthropy event this Sunday. It's called Hoops and Scoops. We're doing it towards Crohn's and colitis. We're having a 3-on-3 basketball tournament. So if you want to get involved, we also have a GoFundMe page if you want to donate like that. So with the basketball tournament, we also have all-you-can-eat ice cream for $5. And yeah, thank you.